About 10 years ago, some food started to bother me. First, it was dairy products. Later, legumes were added to the list. Then, fermented foods. I tried to treat these issues on my own. I did elimination diets and took various supplements. Then, when I couldn't cope with it anymore, I completely stopped eating those foods. About a year ago, I developed diarrhea. Every day, all my bowel movements were in the form of diarrhea. Of course, since we always avoided colonoscopies, after a year I finally decided I couldn't postpone it any longer and made up my mind to see a gastroenterology specialist. We also like Medical Point Hospital. A year ago, my spouse had surgery here. After doing some research and reading the reviews about Mr. Omer, I chose him for his experience and calm demeanor and made an appointment with him. I explained my problem. He told me that colonoscopy should not be avoided and that it is a very preventive method. But I was so sure that nothing would come out of it that he would just prescribe me a few medications. I thought I would just continue my life perfectly fine after that. Then didn't he say, "You have a polyp in your colon with a diameter of 6 centimeters and it needs to be removed"? Of course, first we need to see the biopsy report. An MRI scan is also necessary. These were completed. He explained that it wasn't cancer, but that there were formations highly prone to becoming cancerous. So we decided that LSD should be performed to remove it. Right now, it's exactly the 72nd hour and I feel perfectly fine and well.
Our patient, Ms. Aishi, summarized the onset of the illness and her complaints very well. In fact, due to her age, she should have had a colonoscopy done earlier. But she came to us recently because of increasing bowel complaints, especially diarrhea. And during the colonoscopy we performed, we observed a mass-like polypoid formation, about 6 centimeters in size, in the last part of the large intestine, which we call tubulovillus, and which could indeed be causing this diarrhea. The pathology results we received also showed tissues predisposed to cancer, just as we expected. There are 2 treatments for this, either surgery or removal using our endoscopic methods, because these types of tissues can turn into cancer in the future. We explained the possible risks and the effects of the treatment methods to our patient. About 3 days ago, we performed an endoscopic submucosal dissection. We completely cleared it from its base. Hopefully, if pathology results come back good, he will have gotten rid of this without surgery.